All right. Good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Way to Health. Today, Kathy and I are here, and we're talking about stem cells. Good morning, Kathy. How you doing?
I'm fine, Dr. Gates. How about you?
Doing well. So last night, Kathy and I were talking about what we should broach today, and we got on the subject of stem cells. And we're both looking into it. I have my observations, and I've done some research over the years. I did some research last night, which we'll talk about. But Kathy, kind of what is your perspective on this?
It's kind of that, excuse me, of the novice. I've got friends who've talked about using it. As we know, I'm not a young person, so there's more and more people my age looking into this sort of thing as opposed to surgeries for knees or hips or whatever. I'm surprised at the gamut of things that they're trying to use it for, whether it be Alzheimer's, MS, Crohn's, like I said, the arthritis. And, I mean, we hear a lot about it. We don't know a lot about it. Why don't you give us an idea? I mean, where do they come from? How do they harvest them? How do they use them?
So the stem cells that are being used today come from a variety of sources. They can actually grow basically a little, you would think of it as an embryo in a petri dish. They take them when they're 5 to 7 days old, basically, and that's the embryonic stem cells. They can take stem cells from an umbilical cord. They can get stem cells from your fat tissue. They can get stem cells from your bone marrow. And so those are the primary sources being used at this point in time. And there's a lot of debate, and because stem cells are new and because there are these private clinics, everybody's saying their stem cells are better and they have maybe patented ways of extracting different factors from the stem cells. But for you as a patient, it can actually be pretty confusing as to what is valid, what is legit. And it's confusing to me at this point. So I can't really give you a definitive answer. We're going to keep looking into it. I think it would be good, Kathy, if we kind of came back next week and chewed on this again. But I know I have a lot of patients ask me about this, and Kathy has a pretty good perspective on the totality of the issue too, because she had bad knees, as she's going to talk about today, and she would have been somebody probably looking at this, but we've done our work, and now she's had some pretty amazing things happen lately. So that's kind of the summary of where they come from and what the lay of the land is.
If I go to one of these clinics, I'm always the person who wants to know what's behind the curtain, on the Wizard of Oz.
Right.
So if they're going to take these from my fat or from my bone marrow, so their clinic apparently has a lab where they're going to go in and separate this fat and those stem cells right there in their lab.
Yeah,
correct?
Yeah, exactly. Most places do that.
And so that on the internet, it kind of talked about that's why it's so expensive. They've got to have the sources and the help that are trained in that sort of work and know how to do that. So, folks, I don't know who's looking at it out there, but 5,000 to 8,000 seems to be the small number.
Right. Right.
To have this done for, say, your knees or your elbows, or if you got tennis elbow, whatever issue that you're dealing with. So, and insurances do not cover this, right, Dr. Gates?
No, not typically. Not typically. Usually it's totally out of pocket. In fact, when we're talking about the ambiguities of this, I'm not doubting stem cells. I'm just saying there's a lot of confusing variables out there that nobody really has answers for. 2 weeks ago,
it's still pretty young, right?
Yeah, still very young, exactly. And I was actually really hoping to find more definitive research last night, and I didn't. Last time I looked into stem cells was about a year ago, and at that time, it was kind of a crapshoot, so to speak. Well, you should do this, you should do that. And I'll try and pinpoint that down a little bit better. But 2 weeks ago, I was flying down from Reno to Vegas, and I actually sat next to the office manager for probably the biggest stem cell clinic here in Vegas. And she had some really interesting points. And she was pretty convincing, and I think maybe she was right on some things, but still it's confusing. And it's probably, if it's confusing to us, it's probably confusing to a lot of you. So that's kind of my take on it.
I guess my other question, I'm always playing devil's advocate. And I'm anti-surgery, so no, right. I don't want my knees replaced right. or anything else. I want to keep what I've got. what, I mean, do we see real downside? Everything I saw on the internet looked like, okay, a couple days, you're ready to go, and everything should be hunky-dory when you got finished with this sort of thing.
Mm-hmm.
Has it been around long enough to see if we have any big downside?
I would say with what they've been doing in Europe, and there's some pretty big clinics down in Panama, I'm not seeing a lot of downsides, and I've had a lot of patients get stem cell treatment, so I'd say I can't say I've seen downsides. The only downside I've seen is that it may not work.
Okay.
Yeah.
That's a pretty big one if I spend $8,000.
Or 20 or 25.
Or 20. Yeah, as it said, as the internet said, for Crohn's, MS, Alzheimer's, psoriatic arthritis, rheumatoid arthritis, it could be $1,000.
Oh, and Kathy, I'm having a hard time hearing you. It's like, it was kind of like you're fading away. Say that over again.
Okay.
Yeah, there you go.
I was saying that the internet showed that Crohn's, MS, Alzheimer's, psoriatic, and rheumatoid arthritis, the cost was much higher, more in the $25,000 to $30,000 range. Which, I'm sorry, folks. I mean, I had a friend looking at this stuff, and she's like, okay, but my insurance won't pay. And, you know, she works in a hospital or whatever, and, you know, coming up with that kind of cash, you work in a hospital because you get good insurance, but if it won't cover these things, then you need to be looking somewhere else. I keep pushing diet, and some of my friends and cohorts listen, but it's very hard to change people's diets when they haven't done a program like yours, Dr. Gates, where it's just that, a program that you go through and you get step by step, so that when you get to a certain point, all of a sudden the little light goes off over your head. It goes, okay, now I see why I'm doing this, and now I know why I feel so much better than I did when I started, 6 weeks ago. To me, that, and Dr. Gates said, I was going to tell you folks this, we just moved out of what do we want to call it, a 2 or 3 story house, Dr. Gates?
It's 3. I'm going to testify it's 3, because I did 1 day of it, and I was exhausted.
Dr. Gates helped us the last day just finish up getting everything out of this house. And I told him I had my Fitbit on, and one day I did 9.25 miles up and down those steps. At 65 years old, and could I have done that 6 years ago in my 50s? No way. Until I changed my diet, use the supplements that Dr. Gates recommends to help with the inflammation. I think that's the biggest thing we don't understand. I played sports all the time when I was young. Loved sports. Ended up quit playing sports because my knees were so bad.
Wow.
It's like, okay, no, you can't play tennis because,
Right.
I even moved to Tahoe, and I'll ski. And no, I'm not going to ski. I can't do any more damage to my knees.
Smart.
They're already so bad. I can't go through that. But it, now at this late date, it dawns on me that, okay, it wasn't the sports that was killing me and my knees. It was, what I was putting into my body. If I was eating a ton of mac and cheese or a bunch of bread, a bunch of cheeseburgers, or, whatever it was, that we now know that I have a real issue with gluten. We also know I have an issue with dairy, all these different things that cause inflammation. I think I know I keep beating this drum, but people, you need to realize these foods can do this to you. Some foods are not your friends. That's just the long and the short of it. They are probably nobody's friend, quite honestly. And to be able at this age to say, okay, I do away with those things, and we've talked about it. I cheat, and if I cheat, I pay for it. Had I eaten those peppers and pasta that we do sometimes, I wouldn't have made it up and down those stairs 3 times, let alone, I have no idea how many 9.25 miles is, but it's a lot.
Especially up and down the stairs.
Yeah. So, I mean, and I told somebody that I guess I've never had a stress test, but I think I just took one last week. So I don't think I have to have one, and I think I'm in pretty good shape, for my heart anyway. But it just amazes me that, like I said, 6 years ago, before I worked with you and changed diet and worked on the natural supplements that you use, I would never, ever, ever had been able to get up and down those stairs like that. And I had, my husband was there. There was some much younger people than me there, loading truck and stuff. And they're like, "This is killing us." I'm like, "Okay," but think back, people. When did you start hurting? I had just as much pain probably in my preteen years or teen years. Just if I really exercised or did something, I really paid for it.
Right.
But if I think about it, okay, maybe we were out, maybe we had a picnic, maybe we had a bunch of hot dogs and hamburgers, maybe we did this, we did that, maybe it was a cookout, something, and we were maybe playing touch football, whatever, but the next day you paid for it. And you probably paid for it for a few days. But most of us think it's the physical activity that causes that pain. And yeah, maybe if you got hit real hard, that's what you're going to pay for. But at the same time, if it's a lingering thing, I think we really have to start looking at that food source and paying attention what we're putting into our bodies. Think of yourself as that Ferrari. If you put crappy oil in it and some really cheap 85 gas, it's not going to run, and it's not going to be happy, and it's going to feel sluggish. There's just lots of things that I think there's so many people. You always say, Dr. Gates, you're almost everybody's last hope. They feel so bad, and they've been everywhere. And nobody can tell them what's wrong or what they should do to feel better. And like I told you a while ago, when they get to be my age, everybody just wants to write it off as old age, and that, hey, I've only got a few good years left, so if I need to have knee replacement, or I'll do stem cell, or whatever I need to do, that's where they turn.
Right. And it's because we've been so conditioned for one treatment for one condition. So it very much fits. You've done what you've done throughout your life. You've ate what you've ate. You've had inflammation. You've gained weight. Maybe you haven't. Maybe you've just pounded your body. If you're a runner or something like that, and you have bad knees. So you're either looking at a knee replacement, or you're looking at something like stem cells. What's similar between those two is that it's a passive treatment, meaning you don't have to do much except maybe pay for it. But you just go in, you get the stem cells, or you go in, you get the knee replacement. That's why I think it's so provocative to people, because it's kind of, if they don't want to have surgery, Kathy, then they can go have the stem cells. And I totally get that, and I'm not completely knocking it, but I'm with Kathy on this. If you don't want to shell out around $10,000 to $30,000 for something that may or may not work, you may want to start really looking at what the inflammation in your body is doing to you and what your eating is doing to you, as Kathy's saying. Because when I got turned on to this, I had a patient fly to Southern California who had multiple sclerosis to get stem cell treatments. And at that time, they took their fat cells, spun them down, and they injected them into their nose and other parts of their body, but not directly into the nervous system. And that was kind of my first I don't know. I became a little skeptical, because the concept of stem cells is great. And I think there may be cures or not cures, but maybe dramatic improvements for things like MS with stem cell treatments down the line once this science has been perfected. But just that example was a patient who didn't really know. They were told one thing, hey, this may cure your MS. But on my side of things, I'm thinking, well, why didn't they just inject it into the cerebrospinal fluid? Because that would make the most sense. That's where the MS is. It's in the nervous system, rather than injecting stem cells around the nervous system. And that's one isolated example I have of just something where I think it's important that all of you do a lot of due diligence before you go into this. When I was flying down a few weeks ago, talking to this manager of the stem cell clinic, what she said that resonated with me was the fact that they use bone marrow from the hip to inject into like the low back joint. So if you have arthritis in your lower back, or if you have arthritis in your knee, they actually take your bone marrow, which is a very similar type of tissue, to inject it into that region. Now, I was also reading research last night where they said basically, that may not be accurate. Maybe you can take fat cells and they can have just as potent of an effect as bone marrow cells. Or maybe you can take umbilical cord stem cells and have the same effect. So that's why I say it's still kind of the Wild West. It's still open. It's still, we don't really have the thing yet. I know at Stanford a few years ago for stroke patients, they were actually looking at taking boreholes out of the skull and then injecting stem cells into the site where somebody had a stroke. It's a novel theory. We'll see if it works. But that's kind of what I know on stem cells at this point. Any thoughts on that?
Can I ask you a question?
Yeah.
Okay. If someone has MS, which is a degenerative disease of tissue and muscle and whatever, and you put stem cells in, because what I read online was that those would go in and be new cells, repair other cells. Okay, and I heard you use the word cure. Can it cure it? Or is it just going to repair those cells that are damaged now, and is the MS going to keep damaging cells?
That's what we don't know. In my opinion, MS stems from the gastrointestinal tract, and it's a vicious cycle. So maybe if they injected stem cells there, maybe that would produce the best possibility. But injecting it into the nervous system at least seems to provide some capacity to heal lesions, especially that research is being done in mice. You can actually induce MS in mice. And so it seems that the stem cells can repair the scar tissue, perhaps, in the nervous system of MS patients. So that's interesting. So that's why I waffled on a cure when I said that. Maybe it will be a cure down the line, maybe not. But
I'm assuming in 5 years we'll know a lot more about it.
I hope so. I was actually a little dismayed last night that we didn't know much more about it now than a year and a half ago last time I looked at it. So, but maybe
you would think
that's why.
Because if they're using it this readily and they have these clinics, that there would be a good deal of knowledge out there for folks to check on. And I was like you. I found stuff that talked about it and how much it cost and what you could do, but it didn't really elaborate past that hardly.
Well, and the thing that I see, basically stem cells are considered alternative medicine. And once you get into alternative medicine, and this is what I got back from talking to that office manager, everybody has their proprietary little thing. So lots of times people may not publish, because if you publish research articles, you have to tell people what you did. You have to tell them how you did it. My sister is in research, brilliant woman, and she goes to great length and explaining exactly how they cultured whatever and how they did this and how they did that. So
as soon as you do that, you've given away all your secrets.
You're giving away the secret sauce, so to speak. So that might be part of it too. So
very well.
Yeah. So we're hitting you with the reality this morning. So I think this is a very frank discussion. Again, I'm not knocking it, and I have friends who do stem cell treatments. Awesome, and they report great results, and I don't doubt it. But as you, as a patient, as a consumer, all we're saying is think of maybe other things you can do, less invasive, that may have a more long-term effect. Because if you get stem cells, kind of like Kathy's alluded to, she could get stem cells into her knee or knees, and it may help for a short period. But if that inflammation wasn't fixed, what's going to happen in the long run? So
that's what I was just going to say.
Yeah.
If somebody's working with you, they're going to put their whole body in balance, and it won't be just their knees that's better, their back, their shoulders. With my headaches, they're pretty much gone.
Right.
And then we're talking 60-some years of headaches. So putting a body in balance definitely has its advantages, and it's not something that all doctors talk about or purport, because if you're in balance, you don't really need to go to the doctor all the time or take any prescriptions, because I don't take prescriptions. So I really enjoy that. And when I fill out paperwork someplace or something, if I have to go to the eye doctor or the dentist, they're like, well, we need your prescription. I'm like, I don't have any.
And they just look at you with a blank stare.
And I'm like, I'm very proud of that fact that I'm not on, heart medication or stuff for statins or any of this other stuff that I know has long-term debilitating effects to the human body. So I would much rather keep things as clean as possible.
Gotcha.
And I'm not bragging, because folks, I had to go through this program, and it was not, I was a big baby when we started, but once things started feeling better, then it's like, hey, I see the common sense of this. So, and again, I am a common sense person. So if it makes sense that you don't want to be in pain and you don't want to have a headache the rest of your life, or you want to be able to get up and down the stairs, and maybe look at your older golden years as being somebody who can get out and do a few things instead of sitting in a chair or riding around Walmart in one of those scooters, then talking to Dr. Gates may be the way to go.
Yeah, I'm with you. So it's 8 o'clock. I got to see some patients now, but thank you everybody for joining. We have this on YouTube too. If you want to go back and watch it there, watch it on Facebook. 833 Dr. Gates, 833-374-2837 if you have any questions. And anything else you wanted to close on, Kathy?
No, I think we've said it all for today. We'll follow up on the stem cell stuff next week.
Yeah, I'll do research this week, and I'll try to pinpoint some conditions, and let us know what you think. That's what I wanted to say. Let us know what you think. Let us know, have you been looking at a stem cell clinic? What makes sense to you? What are you being told? And I'll try to dig into research. What conditions do you want us to talk about next week? Because if you post that attached to this Facebook Live or just whatever, email us, then I'll go in and I'll look at rheumatoid arthritis as it pertains to stem cells, or I'll look at MS a little deeper as it pertains to stem cells, or spinal cord injury. I have somebody who wanted me to look at that. So that's what we'll do. Okay. Sound good, Kat?
Sounds good.
Okay.
Yep.
All right, guys. Have a good weekend. And this, perfect. And we're ending.